Welcome to Democratic Television, a program of the Santa Clara County Democratic Party that brings insights, perspectives, and attitudes of our always thoughtful Democratic guests. Today we're lucky enough to have Kathleen King with us, currently the Executive Director of the Santa Clara Health Foundation.
Santa Clara Family Health Foundation.
You know, and without that word, it really wouldn't mean so much.
You're right. Thanks for inviting me, Steve. I really appreciate it.
Well, we have a lot to talk about. Healthcare is going to come up in our show. But before we get there, let's talk a little bit about you. You're the Executive Director of the foundation now, but you've had a varied career. But let's go back to the very beginning. So where are you from?
Well, I'm a third generation born San Franciscan on both sides of the family, but I pretty much grew up in this area back when there were very few houses and lots of orchards.
Yes.
And I come from a large family, Irish Catholic. I'm the oldest of 7, born within 10 years of each other, all together. And my mother was from a very large family of 10. So I went to public schools, Blackford High School, same school as Carl Gardino. And then I went to West Valley College, and then I went to Santa Clara University.
Oh, very good.
Yeah.
So growing up as a youngster, did you have any notion that you would be the executive director of a foundation or an engineer or, frankly, an elected official? Did you have any motivations, heard a great speech?
Oh my gosh, I never thought I'd run a foundation, and I never thought I'd be, you know, strong in a technology company, but being the oldest of 7, you are always trying to be the leader. And in that I was the shortest of the 7, maybe that gave me some leadership skills because I really had to work at bossing around my brothers and sisters.
Well, that's beyond survival, so you clearly have done well.
Well, I had, my parents really knew how to raise a family unit. It was clear as of 7 of us, we were a team together. No crybabies, no whining, but you really look out for each other. And maybe that's what goes into, mostly into running a nonprofit, is you're looking out for somebody besides yourself. You really care about what happens to others more than what happens to yourself.
One term for that could be you got good organizing skills or a real sense of community.
I think so, and you learn how to, in a large family and in an organization, you learn how to leverage. So most of my approach is how can I leverage a few dollars into many dollars in order to first start taking care of a few children and then start taking care of a lot of children. So I think many of those skills come from fighting it out in a big family.
So you went to Santa Clara University. Did you have a relevant major, a major that you then capitalized on and got you into high tech? Or
that's pretty interesting because I started out as a Spanish major. Which I had lived in Spain for about 6 months before I went to Santa Clara, and I thought that would be a good major, but I found myself gravitating to all business classes. So I ended up graduating as a business major and didn't take very many Spanish classes at Santa Clara University.
Yeah.
And I think that's how I ended up into high tech. There weren't that many women back then. I hate to say how long ago it was. But there weren't many women in high tech, and so it was just kind of an up-and-coming field that was really a great place for a young woman with some skills to start.
So what did you do in high tech?
Well, I started out at American Microsystems, and then I went to work for Applied Materials, and I worked there for 20 years.
Well, that was a good choice.
Yes, it definitely from a stock standpoint, and also Jim Morgan, I was there the Jim Morgan years, and he is an amazing person. So I worked in sales and marketing. I either ran sales groups or marketing groups. It's kind of a funny story, but Intel did not buy any products from Applied Materials till I started selling to Intel. And then a key executive from Intel came to work for Applied Materials, and I sold him his first system. So, you know, it's just evolved from that. But Applied Materials was a great company to learn finance and the importance of managing many parts of a company.
Well, they have a reputation now of doing so much for the community, the Turkey Trot, and so much nonprofit and giving, which I know you've been a part of. And
yes, but that was, I would say, more so after I left. You know, when you're young and you're in a tech company, it's kind of like the Facebook people. All you think about is how to get that business running and how to get it to grow. So I was there from when it was about 63 million up to when it got to 10 billion.
I see.
So I wasn't thinking much about nonprofits at that time.
Got it. Well, you were thinking about family. Apparently you got hitched and
yes.
started having a family yourself.
Well, and that made a drastic change in my life because our youngest has a extremely rare syndrome. There's only 300 cases identified in the world. I mean, when we get together, it's a very small group of people, and it was pretty hard to diagnose. And he ended up going through, I think we're at about surgery number 36.
Wow.
And 2 bone marrow transplants.
Wow.
And that is life-changing, because at the time, 1 out of every 5 children would die of bone marrow transplant, and we ended up having to go through 2. So it just changed my whole focus.
And so your other children, your husband, and you just said, we're going to make this work? And
yes. You know, once you go through, I mean, you have to have the time to spend with a child like that because he's still a severely delayed child, and so somebody really has to, one, focus on getting his diagnosis, which was not easy, and so we decided that it would be better if I did more advocating and left Applied Materials, and they were wonderful. They let me take a leave of absence while I was dealing with a lot of these issues with the youngest, Robert, and I decided at that time I thought we should have a children's hospital in San Jose. So I worked on that for a couple years, and we got very close. But it needed a lot of political persuasion, and so then I went into city politics.
yes, so you did a stint as council member and mayor and council member and maybe a few stints.
Yes, and mayor again.
Well, what motivated you to want to serve the community like that?
Well, I felt it was a way to get to my final goals, which were around children's health. Oh. But you get into city government and you find out it has its own life. And there are lots of things to do in a city that help the people you know really well, because you'll know the people around you. When I run in the morning, I will get people lowering their window in their car saying, you know, the street light's out up at, I go, okay, when I get back, I'll call it in. Right when I get back, it'll be done by this weekend, you know. Oh. One I called in, it was at the bottom of Montalvo. There was a big pothole. I called it in, and the next day it was fixed. So you're
a hero to many.
Well, I think I'm a hero to my family more than anybody else.
I think it's much wider than that because you were always reelected.
Yes.
But healthcare and city business are fairly divergent.
Well, in some ways they're not. I mean, a lot of land use can make a difference in people's health. In Saratoga, we'd fought over, I think, 19 years whether we could get a bike path along the street in front of the high school that really connected with the middle school and the college.
Oh.
And of course I used that path, my kids used that path, so it was not something I was willing to let go, and we finally did
19 years?
Well, what it did is it did have to take the parking away from one side of the street, which affected about 7 or 8 homes. And those people were not happy. But now it's much safer for the kids and people to run and walk along that. So there
isn't a good example. Yeah, that does work for me.
Yeah, and we learned how to take school soccer fields and make them useful for the groups on the weekends. We did things that made it just that more accessible for people to use outdoor spaces. So it was really fun. It's a fun, I mean, I recommend it to anyone to be a city council member.
Really?
Oh, because you get to see change around you. You get to see street improvement. You get to see safety improvement.
But then, you know, the federal government thinks, let's close a post office, and people rail at you saying you can't let it happen, and yet what can you do? So there's got to be a level of frustration.
Oh, you remember that one. Yeah, there was, and not everybody understands the economic dynamics, and not everyone will agree with the economic dynamics, but I at least try and help them understand that, you know, maybe this space, this post office is costing a lot more than it brings in. That's not going to change long term, and you know, how can we push, how on one hand can we tell government you have to be more efficient, you have to get your costs down, but say, but I want this open, and I'm okay with you taking the losses. So you fight those issues quite often, and you fight a lot of neighborhood issues.
Well, but also when you're serving as a council member, and maybe more so as the mayor, you're meeting a lot of other people outside the community, making contacts, and maybe if you do have had this vision about children's health, a hospital, you're able to test the waters, see what the Board of Supervisors is willing to stand up and commit to?
Absolutely. That's a really good point, because there's an area up just above Saratoga that there's a couple of, Water District owns a space, the county owns a space, but if you can get the use of those spaces, you can do a whole Saratoga to the sea, because it goes right over to Castle Rock and right over to another part. And so we were able to get Liz Nist to leverage county funding to use some of that county space and Mid-Penn. So we could put in, I think, a quarter to a third and get matching in order to make a path to the ocean. So we've had tremendous success in knowing the rest of the political people in our community to leverage dollars.
Wow.
Yeah.
Okay, we're going to take a little break now. When we come back, let's talk about the Health Foundation and why that's so important.
Thanks.
We'll be right back with Kathleen King.
Hi, my name's Dave Cortese. I'm the president of the Santa Clara County Board of Supervisors. A lot of people come to me day in and day out asking, how can I get involved? How can I make a difference in my community? Well, one of the things you can do is contact the local Democratic Party. As a lifelong Democrat, I know that that's one of the most inspiring and useful things you can do to help people, especially people who can't stand up for themselves. If you'd like to do that, there's a couple of ways to contact them. You can use their phone number, 408-445-9500, or go to the Democratic Party website, www.sccdp.org. If you want to make a difference, there's probably no better way than contacting our local Democratic Party. Thank you.
Welcome back to Democratic Television. We were talking with Kathleen King about a lot of interesting stuff, and we're going to continue that.
Thanks, Steve.
So you are the executive director of the Santa Clara Family Health Foundation.
Good job.
Was that right?
Yes, you got it right.
Good. And the family was the key word.
Yes.
So what brought you into that position? Tell me a little bit about being the executive director. Why are you doing it? What do you do?
Well, I think I found out that our county is the first county in the United States about 11 years ago to try and put a universal health care together for children. And what they did was they tried to make it very easy for families to apply for the 2 state and federal programs, Medi-Cal and Healthy Families. But the next step, which Working Partnerships was very involved in, was forming a next level, which is called Healthy Kids. And it allowed all those that didn't fit, that were low income, that didn't fit in the state or federal programs, an option for health care. And that got me very excited because...
So without that effort, there would be children without health care.
Yes. So back 11 years ago, 1 out of every 6 children in this county did not have health coverage. And now we're at about 95 to 96%. We've added 85,000 more children into health care in this county than we had in 11 years ago.
85,000.
Yes. And so that was very exciting to me. There was a point in my son's second bone marrow transplant that I got a letter from the insurance company saying they would only cover half of the second bone marrow transplant. And I had to that weekend figure out how we would sell our house, how we would sell any investment we had, because a bone marrow transplant's about $1 million. And when I called on Monday, it was actually a letter between the insurance company and the hospital, not for us.
Oh.
But the feeling of what it's like to not have anything left, because the survival of your child is the most important thing. I mean, we were going to clean out every child's college savings to make sure we could pay for that second bone marrow transplant. People shouldn't feel that way. And if we're going to educate our children, the best way to educate them is to have them healthy, or we're in essence wasting money. So we now have 96% of the children on health coverage. And I didn't get to be there at the start of it, but I want to be there to make sure that it lasts. And it's a lot of it's due to philanthropy, so it's not an easy, completely easy effort to make sure that we have enough funding for all the children.
So that means that the government, various levels of government, aren't able to continue funding. We know how precarious funding is at all levels of government. That's where the foundation comes in that you're the executive director of.
Right. So our mission is to raise funds for all low-income people to get into some kind of health coverage. So we do more than the children. We work with, we're focused on the Santa Clara Family Health Plan, which is a plan for low-income families, and we raise money in other ways. But our real focus, our passion is no child in this county should go uninsured. We think it's unacceptable. And
so the vehicle or the hospital is the Valley Medical Center.
Yes, the children can use other choices, but most of them, because the county has a fairly broad clinic base throughout the county. So one thing is getting access where these children are. So the county is the safety net. But the program does bring medical, dental, and eye coverage.
So it's not just medicine. You were mentioning earlier to me how important dental coverage is, especially for young kids, and frankly, the state of alarm that you shared with how bad some kids' dental circumstances are.
Right. First Five funds 2 clinics for children, dental clinics, and they said last year there was almost 10,000 children under 5 that needed root canals. And so a lot of that is preventive training. And people don't necessarily know that you should be taking your child to the dentist at the age of 18, 24 months. And there's a lot of learning that should go on with children and their dental coverage when they're very small. So we now have 96% of our children on coverage. I say it's time to take it for a ride. We need to figure out what can we do when we have that large a quantity of children on? And there's efforts going to reduce asthma, emergency room visits, the dental. It's a very exciting field to be in, because if we can make them healthy through school, we actually have statistically valid data that show children are in school more.
Oh.
And we prepare them for proactive health care as adults, because they'll have learned as they grew up.
You're teaching modern health.
Well, care visits.
Yeah.
I mean, you look at the statistics on these kids, and their parents take them to their well care visits. In fact, their rate of taking them is higher than mine with my children. So I feel like parents get it. Once they have the availability, they use it. They definitely use the dental. They're good about getting the teeth clean, etc. So it would be, I could not live in this community unless we can find a consistent way to keep this going forever. It's unacceptable to me to have it any other way.
Well, that's a great mission. It's a heavy responsibility.
I may die doing it, but I'll be happy.
But you have, in this county, I think, a board of supervisors that seems committed to that goal, too. Of course, they have lots of other responsibilities, but providing that health care is one of their main missions, as I understand it.
Absolutely. And what they understand, and what most of us understand, it's inexpensive to take care of children proactively. Because if you take care of them, they don't end up needing urgent care very often or emergency rooms. So the county,
more expensive care.
Yes. So the county understands if they can take care of this preventive and pay for it now, they won't be paying for it in the emergency room, where children, when they go bad in a hospital, they go really bad fast. So the effort is to make sure we keep them healthy up front and in school.
Now, there are some other programs that you guys take a look at. Help Fund, I assume. A Healthy Workers program?
Yes, so that's a program that works with employers to low-income employers. I think the workers have to make under $18 or $19 an hour, but it's a shared cost. The county picks up half the cost, and of the part that the employer picks up, the employee and the employer picks it up together. So it allows workers who otherwise wouldn't be able to get any of this preventive care get their coverage.
And the reality is that if these folks don't have coverage, they're going to end up in the emergency room or urgent care anyway at much greater cost.
Exactly. And what they found with the children and the physicians were, when families don't have health coverage, it's not just the issue of seeing the doctor, it's the pharmaceutical costs. So doctors were saying they would see people over again and over again because they couldn't afford the medications. So, and then you do see, we've had families in that they would have gone bankrupt if they didn't have a proactive plan for health coverage. You know that. Yeah. Meeting them and talking to them.
So this specific plan is one, it's voluntary for employers that want to step up and make sure that their employees are healthy, which certainly makes sense.
Well, and it covers them too.
Yeah.
So, if they have a family, it's important, they're looking at it as, yes, it's a little bit of an effort for their employees and to do it, but it's either their employees are like a family or their own family is part of it too. So, I mean, it all leads into, I think, what potentially is happening with healthcare reform, that healthcare right now is costing this country 17% of gross national product. If we don't figure out a way to get a lot more proactive about healthcare, it's just continuously going up. And
it seems to me that our state is trying to get ahead of the curve too, and so you at the county level are trying to get even more ahead, because at some point the Obamacare plan will have greater expectations of the local community.
Oh, absolutely. We'll have all these new people coming into health.
Yeah.
And the thing is, when we did it with kids, there was capacity. So you had doctors and everything. We need to get the county ready for that. No use to get health coverage if you can't get an appointment. So, there's a big effort right now in the county to make it more efficient, more effective, get ready for all this.
People are talking a lot about the problems associated with childhood obesity. Does the health plan try to do preventative stuff there, education and all that?
Absolutely. We have a great program called 5 Keys. And I some of these classes, it's great for anyone to attend. I attended it, and it was really interesting because the parents with their little children wanted to learn good eating habits. What's acceptable? How do I handle my child when they throw the vegetables on the floor? What about juice? I mean, and we found it very effective. Parents want to know what's best for their children if we can get that education out there. And with so many children and their families in healthcare, they're more likely to get that education.
We only have about 3 minutes. I know the county is looking to do something in the ballot to help fund the health plan or health care. Could you briefly describe that?
It's called Measure A, and it's to support priorities in the county. Many of those are the trauma emergency. I know personally I had a daughter that was in a car accident, and we were near Good Sam, but the ambulance says, oh no, this is trauma. We need to take her to Valley Med.
The public hospital.
So 1 out of every 4 of us will end up in that hospital at some time or use the clinics. And I don't know, for me, I want to make sure it's there if any of my family uses it, needs it. So it's trauma, it's burn center, emergency room. It's also schooling services. It's and it's the Healthy Kids program. So many of us and our voters are worried about what may happen at the state. More of the requirements are being pushed to the county without money. And so this is a way we make sure that funding that comes in is only used locally.
And it's a slight tax on folks.
It's 1/8 of a cent sales tax.
Oh.
It's pretty small, but it's hard in a county to have the ability to be very proactive because every year there's less money and more cuts. The county's cut for the last 10 years. This will allow us to keep some of those very good programs going.
1/8 of a cent, it doesn't sound like much.
No, it's
I guess
not.
it's not on a personal level, but then...
I think it's a couple cents on a cup of coffee, you know, at Starbucks. I mean,
Yeah.
your tax will go from 17 cents to 18 cents
Yeah.
when you have a cup of coffee.
Well, our time has just almost run out. Let me ask you quickly, if someone wants to get hold of you to learn more about this or to volunteer or to make a contribution, could you share an email address?
Oh, we would love help. We would really appreciate it. It's my initials, KK, and the number 2, my last name King, at Comcast.net. KK2King at Comcast.net.
Well, that's great. Well, Kathleen, thank you very much for being on the show. We appreciate all the work you've done for all these years and all the work that you're going to do.
Thank you, Steve, for all the work you do. Thank you.
Thanks for watching Democratic Television. Give us a call at 408-445-9500 or visit our website, www.sccdp.org. Help make a difference, and we'll see you on the campaign trail.